It's not really as scary as it sounds. I feel like that's one of the bigger pieces because nurses are involved in innovations and integrations for technology by proxy their entire career and every day. They don't necessarily have the ability to be someone that has a say so in how it's delivered and how it affects their daily ins and outs and how it affects their patients and their workflows and things like that. And I think that one of the things that we're learning and the visibility in this space as it is right now is just that it's not as scary and it can be really beneficial.
And then what would you say to a nurse who thinks they might be interested in working in health tech?
I love it when nurses apply their knowledge to different areas because your patients live everywhere. Your patient support systems are everywhere. And when you're talking about trying something different or looking at a different avenue in nursing to apply your skills, there's nothing wrong with just making yourself more knowledgeable and more marketable in this space. You learn different skill sets and tasks by doing them. And 90% of nursing is learned on the job. And this is another aspect that's learned while you do it. So I think that expanding your knowledge, expanding the safety net that other nurses have by having somebody step out of their comfort zone and then learning from them only makes things better for nurses in general. We're not going to get further away from technology and all of these things. It's only going to become more part of our day-to-day routines and everything that we have to do for ourselves and our patients. And so becoming comfortable or stepping out of your comfort zone and just taking that step, I think, is something that becomes an invaluable sort of skill and resource for people, because then you become someone that people look to and say, hey, you tried that, and they come to you for that advice, and you can encourage people to do the same thing.
And nurses love having the answers, don't we?
I sure do. We like being able to say, no, ma'am, that's not correct. Let's get the misinformation taken care of right now.
So, do you think it's misinformation for nurses to think that if they work in health tech, they're going to be staring at a computer all day, not getting to talk to people, be it patients or coworkers or things like that? Or have you found it to be more high touch than that?
I think that there's probably a space in both of those areas. I think that there is a certain amount of misinformation that exists just by experience from integrations with new EMR systems or having to integrate AI and the uncertainty associated with AI, with people thinking it replaces something instead of augments something. And that's directly related to individual experiences or firsthand experiences with people that you encounter. And because perception is reality, 100% of what people are experiencing is valid and it's what they're experiencing. But at the same time, two people can go through the exact same situation and have completely different experiences. And I think that asking questions and inserting yourself, whether formally or informally, in the processes and then the development aspect of things, you have the ability to sort of change that narrative and make it so that information gets presented clearly and with a voice that actually holds the perspective of the people that it would be affecting. So nurses are pretty unique in that they're the people that can pick up the pieces for the majority of areas that they touch in healthcare, but not many people can touch what the nurse is doing. And so that ultimately impacts how you receive information, how you perceive a situation. And unfortunately, burnout negatively impacts your perception of something because it's one more thing to do. Whereas just the right conversation in a different way with a different person can make it look less like one more thing to do and one thing that will help you accomplish something else in a different way. And I think that sometimes that falls into the category of misinformation.
And then do you feel like in your role now, you get to work in a high touch capacity?
So I think that with what we do now in the program development that I'm currently working in, we increase the level of support and accessibility to care in a way that has been very infrequently touched on previously. When you think of accessibility to care in the home, you automatically think of home care situations and things like that. And the ability to sort of just be able and available to have the bandwidth to hold someone's hand through a process and reassure them about something, redirect them when they're focusing on the wrong thing, and reapproach them in certain areas, and then become a conduit for communication between their providers and them. It changes the dynamic of your ability to actually function as a patient advocate and in a nursing role, because you do get further away from that when you're at the bedside, providing the task-oriented support that you're driving that way. So there's visibility into how you can actually support and become part of the care team in a much more efficient and beneficial way that you might not have been exposed to previously.
And what is the company you work for now?
I work for Brook Health, and we are a remote care company and integrating care coordination with technology for remote patient monitoring and chronic care management.
So, in the home, monitoring, getting those things under control and stuff like that.
Yep. So for the prediabetes program, it's a benefit from employers or insurance payers to people that might be at risk related to BMI or their hemoglobin A1C levels. And it's a fully remote program that they have access to health coaches through an app to get them on the right track for lifestyle and behavior modifications associated with healthy diet, activity, and just information surrounding their risk associated to converting to diabetes. And that's really effective. And it uses a very holistic approach where it's not necessarily clinically managed, but it's focused on the gold standard of lifestyle and activity and healthy choices in general. And then the actual remote patient monitoring and chronic disease management that we provide is partnered with healthcare organizations, independent primary care offices, specialists like cardiology, things like that, for patients that have diagnoses of high blood pressure, congestive heart failure, diabetes, obesity, and we help them with lifestyle in the care team aspect, where our nurses are partnered with health coaches, dietitians, licensed practical nurses, registered nurses, the whole gamut, so we can meet the patient where they are and give them a very holistic guidance while at home, while assisting the providers with the actual use case and applicable areas to offer intervention related to the physiological data that they're giving. So we marry the care coordination with the technology and the data to help them guide their patients, manage them more effectively, and help them with symptom management overall to decrease the complications related to their chronic diseases.
So, how did you find the podcast?
Well, your podcast, I actually found it through one of the girls in the ICU. So I was a floor nurse in a step-down neuro ICU, worked in the ER, became the stroke coordinator, and then was the system director for neuroscience for the system I was at previously. But one of the ICU nurses actually, because we had a patient with music therapy pieces, and you had a pretty extensive profile on that. And the patient that we had, actually, there was a really big write-up regionally for us because he was actually a music professor. And so music was the thing that actually brought him out of it. And it was stumbled upon by accident, but then the nurses just went crazy with your podcast.
Well, thanks, Alexandria.
Thank you.
Okay, I'll see you later.
Bye.